with the news of Vice President Kamala Harris as the soon-to-be Democratic nomination for President of the United States, there has been a lot of talk about racism. But let's not forget about racism in healthcare. Join me in our discussion with Dr. Liverpool.
Hello, thank you so much for having me. I'm very well, thank you. How are you?
I'm well, and I'd like to get right into talking about the book you've written, okay? But first, I'm going to take the liberty of reading the bio that I found on your website, okay? Dr. Liverpool is a science journalist and author based in Berlin, Germany. So you're across the pond.
Yeah.
In Germany, her debut book, Systemic, How Racism is Making Us Ill, is now out. And I know that for a fact. I've purchased it via Amazon.
Oh, thank you so much.
Dr. Liverpool's journalism has spanned diverse science topics, including technology, physics, the environment, and health, with a particular focus on inequalities in science, health, and medicine. Her writings have appeared in Nature, New Scientist, Wired, The Guardian, and elsewhere, and she has worked on staff as a reporter for both Nature and New Scientist. All right, but that's not all. Before moving into journalism, Dr. Liverpool worked as a biomedical researcher at the University College London and the University of Oxford in the UK. She has a PhD in virology and immunology from the University of Oxford.
Wow.
So impressed.
Thank you for reading it in that way.
It's
I really appreciate it.
it's an impressive bio. And so your book is Systemic Racism and How It's Making Us Ill. But my first question to you is, how does a doctor in immunology get to the point where she's writing a book about systemic racism?
Yeah, that's a great question. I think there are so many things there. I think part is from my own personal experiences, but also, working in science and then moving into communicating science. As we were talking about this kind of offline, but I recently became a mom, and I was going through pregnancy and was very aware that we're living in a world where there are huge inequalities when it comes to maternal health. So, I mean, this is on a global scale. Almost 90% of maternal deaths happen in sub-Saharan Africa or Southern Asia. But also within, wealthy countries like the United States, like the United Kingdom, we also see inequalities there. So in the US, Black women are more likely to die during pregnancy and childbirth. In the UK too, we see inequalities in maternal health for Black and Asian women compared with white women. So this is a pattern that also exists even in countries that you might think should have a better functioning healthcare system and so on. And so this was something that I felt really compelled to look into further, being a science journalist, but also having myself a background in medical research. I was interested to really investigate this and understand what is going on, what are the factors that contribute to this. Yeah, my new book, Systemic, is the result of my findings, basically. And in the book, I show that, in countries around the world, people belonging to marginalized racial and ethnic groups have far worse health outcomes. And it's not just during maternity, but in infectious diseases. I think we saw this during COVID-19, for example, in cardiovascular disease, so heart disease, stroke, blood pressure, cancer as well, and also in mental health conditions. Across all of these areas, we see inequalities. And obviously, I think this is a horrific situation for those of us in society who are most marginalized. But in the book, I also make the case that this is a terrible situation for all of us. Racism is a global public health crisis. It permeates medicine and science, and I'm happy to talk more about that. It makes our healthcare systems deeply unfair, but also inefficient, right? I think it wastes time, money, the resources in healthcare. And it makes medical research also less effective for everyone. So this is something that I just really wanted to kind of expose. And I think the evidence is really clear. There have been many people, often Black and brown people, who have been looking into this for a long time, doctors, scientists, but also patients, activists, people sharing their personal stories. And I really wanted to bring those stories to light, but also show how it's underpinned by really high quality evidence that really is showing us that racism is a factor that we should really be considering as a public health threat.
That's very good. 2 points that come to mind based on what you just said. The first thing that surprised me a little was realizing that you weren't in the United States. For often, when we associate healthcare, racial health disparities, we always, and rightly so, focus on the United States because it is so glaring. But I think one of the things that I got from your book is that this is not just limited to the United States. And as you just said, it's a global issue.
Absolutely. And that was important for me to frame it in that way. And probably this is very much related to my perspective as I'm a Black European. So I'm British, but I grew up in the Netherlands and now I live in Germany. So I've experienced living in Europe as a Black person, someone belonging to a group that is discriminated against. I think in Europe, a lot of people like to think that racism is a United States problem, and people will
Right.
kind of judge the United States almost as like, oh, look how bad things are over there, and we don't have that problem. But my research shows that actually anywhere that you have discrimination, you then have inequalities in health. So whether that's in the United States, where
That's a very important point because we tend to
yeah,
think that our healthcare system needs a lot of work, but that in the European Union and the UK, things are much better. And to
yeah, and I think there is something to it. So I in the book I highlight, for example, access to healthcare as a huge issue. So definitely there will be differences. I think in the United States there are already barriers when it comes just to accessing healthcare because there isn't universal healthcare, for example. So I think there are those specific things that might differ. But in general, even within in the UK, where you have a system of universal healthcare, so that's kind of a good case study, you see also inequalities. So there are biases, there's interpersonal racism, there are stereotypes about, for example, Black people that are widely held in medicine. And I think it's important to remember that the United States is quite influential as a country. So when it comes to the institution of Western medicine, you have, science and medicine from the United States kind of permeating in other parts of the world. So, even in Africa, we see effects of this where you might think, okay, there's a majority Black population, but actually we see that sometimes, medical textbooks have biases towards lighter skin. And that even has an effect, for example, in South Africa, which again has a majority Black population. But yeah, also in Europe, we see these inequalities. And I think it's important to remember the history of, European colonization, transatlantic slavery. This is something that kind of extends across the Atlantic, right?
yeah, and that's good. And so it's a reminder to us in the United States that it's not just a simple matter of becoming an expat and finding someplace else to live because you really can't run from racism.
Yeah, I think you put that really well.
The other thing that I heard you say was pregnancy was the impetus to make you put pen to paper or do it online, however you wrote your book.
Yeah, I would say there were a number of things that got me thinking about this. When I was pregnant, I was already editing the books. I had already been working on it, but it was something that I guess like a lot of people, I had been thinking about pregnancy before I actually became pregnant. I was actually living in the UK at the time where Black women are 4 times more likely than white women to die during pregnancy and childbirth. And there's been research in the UK showing, for example, that, you know, 43% of Black and Black mixed women report experiencing discrimination in their maternity care. And so I think those things are connected. And yeah, there's been a growing body of evidence showing how racism is harmful, leads to health inequities. But I guess what really kind of sparked me in terms of putting pen to paper, as you put it, is the COVID-19 pandemic. I think that there were inequalities in health, that there was a, let's say there was a spotlight put on existing inequalities in health. So in the UK, for example, people belonging to Black and Asian ethnic groups were disproportionately impacted by the pandemic. In the US also, we saw Black people were being disproportionately impacted.
Yes.
This was really a acute situation, people getting ill, dying from the disease. And in that context, as a journalist, I was reporting on this, trying to grapple with these inequalities. And I think a lot of people were kind of coming to this subject for the first time as that, oh, is the coronavirus racist? Is this something unique about COVID? And investigating this, I started to realize that this is a long-standing problem. And people would touch on it. So they would say, oh, Black people are more at risk because they have higher rates of cardiovascular disease, for example. But I felt that they weren't really digging into the root cause. Why do we have higher rates of cardiovascular disease? It almost felt as if people were saying there's something wrong with us as Black people. There's something wrong with our bodies. And for me, it was actually really empowering to discover this body of research showing that racism is what's harmful to our health. Living in a racist society is harmful. There is nothing wrong with our bodies. And actually, by recognizing that and beginning to tackle the problem, I think that's something really fantastic that we can do to improve everyone's health. I think this is really beneficial to everyone.
Yes, yes. And you kind of start your book talking about Serena and her, her bad outcome with her pregnancy. And her conclusion was basically, they didn't listen to me.
Yeah,
And what
absolutely.
was so remarkable was that it was Serena Williams, a person with status, a person with wealth. And it was, if it could happen to her, it could happen to any Black woman. So
Yeah, I think so.
that was one of the, I think, the first examples that you mentioned. And then you went on to talk about cancer and the fact that
Mm,
we don't necessarily have a higher incidence of cancer,
yeah.
but we have a higher mortality rate. Can you speak about that a little bit?
Yeah, I found that was particularly interesting looking at cancer and the inequalities. I think, like, for example, in breast cancer, let's take the United States as an example, that Black and white women experience actually quite similar incidence of breast cancer, but we see that Black women are dying more from the disease. And I think there are many factors there but I think a big one that I found in my research is looking at when cancer is being diagnosed and when people are receiving treatment. And it seems that there are delays in, Black women receiving treatment. And actually, this is a pattern across other cancers as well. I think what actually surprised me even more was looking at skin cancer, because skin
Mhm.
cancer is not typically thought of as something that affects people with darker skin.
Right.
But actually, skin cancer can affect us, people with darker skin. And in fact, Black people also die from skin cancer at higher rates. And again, it seems to be related in part to these delays in getting treatment, but also with diagnosis. And I spoke actually to a dermatologist based in the US, and he told me that he thinks that many doctors struggle to know how to recognize the signs of skin cancer early on darker skin, because there's a wider problem of doctors not being trained to recognize conditions across diverse skin tones. And maybe I can also just give like some numbers. I'm a scientist. I like to give.
No, please.
So so there was a survey that, or maybe I'll start by looking at the US. In medical textbooks, for example, about 75% of the images in medical textbooks showcase health conditions on lighter skin tones. Just 5% show how those conditions look on darker skin. So we already have that bias there. And then that has a big influence beyond the US as well, because as I said, Western medicine is just really dominant in our world. But then on top of that, we see there was a survey, for example, of users of an international medical teaching platform. So these are medical professionals around the world. And only 5% said that they feel confident diagnosing conditions across diverse skin tones. And that to me was so striking, because this is also self-reported. So, people might be, but it's amazing to me that that figure was so low. And I think that says so much. And it almost tells us that healthcare workers are kind of crying for help in a way, that they are not being trained to treat diverse populations. And if you look at the whole world, we come in all kinds of beautiful skin colors. And I think it's so important that the, medical professionals are trained to know how conditions look on all of those skin tones.
That's right. So usually there's an atlas, a dermatology atlas, which will show you this is what a melanoma looks like. This is what
Yeah.
this particular cancer will look like. But if you never see a picture of a darker skinned woman or man with
Mm-hmm.
skin cancer, then that possibility really never enters into your equation. And so it's,
Yeah.
yeah, that's interesting. So we have these negative outcomes. We have these racial healthcare disparities, but that doesn't really describe what caused these disparities. And then you go into a really interesting discussion about, I guess for a lack of a better term, environmental racism.
Mm. Yeah, absolutely.
You talked about things like air pollution, um, water pollution. You talked about just wealth inequality, even though studies have shown that, like someone like Serena Williams is not immune to racism or negative
Mm-hmm.
outcomes, but on large, there is a large wealth gap. And if you
Mm-hmm.
don't have the resources, it's usually harder for you to find help. Can
Yeah.
you talk a little bit more about just, I think you touched on food deserts and
Mm-hmm.
um, a number of environmental issues and how they possibly play into the negative outcomes that we see.
Yeah, no, absolutely. I think the environment that we live in has such a profound impact on our health. Often, when I'm talking about the book, people have a lot of questions about healthcare and racism in healthcare. And of course, I think we should absolutely tackle that. That's a really important issue. But I really think health starts way before the moment that you step into the doctor's office or end up in the emergency room. Our health is, when we wake up in the morning, what do we eat for breakfast? What environment do we live in? What air are we breathing? So things that you can't even see are already affecting your ability to access healthy living. And we do see enormous inequalities across countries. I mean, in the book, I highlight the story of Ella Kissy Deborah, a young Black girl in London who passed away in 2013 at the age of just 9 because of a complicated form of asthma that she developed because of air pollution in the neighborhood of London where she lived. And her mother, Rosamond, is a really inspiring woman. She's been campaigning for clean air in London, but also beyond. And that's important because this is a global issue. So people of color in England are more likely to live in a very polluted area. And we also see that Black children like Ella are more likely to develop asthma as a consequence of that. But in the US too, Black and Hispanic people are more exposed to air pollution, despite contributing less to the production of air pollution in the first place, and also experience higher rates of asthma. And also, this is associated with other health inequalities. You touched on food environments. I mean, just something as simple as the food that we have access to. Sometimes people don't think about this, but where you live is a huge determinant of your health. And in the US, especially, that's very much correlated with race because of the history of racism and segregation in the US. I think it's impossible to look at health today and health inequalities without reckoning with the history in the US. And I know some people don't want to talk about that, but it's absolutely relevant. And also, there is still racism today that's affecting people's ability to get jobs, to access healthcare, to be able to afford healthcare in the case of the US. So all of these things have an impact on our health. And I think it's important to look at that as well when we're considering then so people are facing inequalities in their daily life, but then maybe they step into the doctor's office and they're also being discriminated against. So thinking about those layers of discrimination and the effect that has on people's health and well-being.
Are you saying that the environmental disparities that we see, are you saying that it's part of racism, it's by design, or are you saying it just happens?
No, I think this is very much a consequence of historical racism that people have been able to live in particular areas, for example, segregation, people not being able to access homes because of redlining to be able to live in a particular area. Then there's been history of, white flight or people leaving certain areas. And then there's also evidence looking at toxic waste sites in the US that they're more likely to be located close to where people of color live. And I don't think that that's an accident. I think it's clear that there is a history of racism and there's a legacy of that history that persists. On top of that, we have gaps in income, of course, that's also associated with health inequality, but also wealth, which you touched on. You know, there's a racial wealth gap in the US. So that also contributes, because when you're hit by some sort of crisis, like, for example, the COVID-19 pandemic, for many people, that was a health crisis, but it was also an economic one.
Yes.
If you have wealth, that's something that you can fall back on, that helps you make sure that you can take care of your family, your health. And so that's also something that affects us. And actually, there's evidence that debt, so the opposite of wealth, is harmful to health. You know, it's associated with stress, cardiovascular disease, all of these things that where we also see racial inequalities. And I don't think that's a coincidence. And the evidence also points towards that. So there's been research looking at racism-related stress. So the stress associated with living in a racist society, that's harmful to health. That leads to increased blood pressure, that over a long period of time, that can be really, really detrimental to our health. And then on top of that, we're engaging with healthcare where we might be discriminated against, we might be doubted, disbelieved, have our pain not recognized. I mean, there are many, many things. As you can see, there are lots of things that I could talk about, but I'm really passionate about this because I think that by talking about it, by naming this as racism, it's really powerful because it means that we can say, okay, this is the problem. We need to invest and dedicate resources towards tackling that. And this is going to be beneficial for the health of our whole society.
Yes. So, question for you. We've talked briefly about the negative outcomes that we see as a result of racial health disparities. And we've talked about things that kind of contribute to that, you know, the environment that one lives in. I guess my question to you is, how do you define racism?
Yeah, great question. So I interpret racism quite broadly in the book. And so you might have noticed I'm looking at this in a global way. So for me, racism is any kind of discrimination against a group of people, particularly groups who've been traditionally marginalized in society. And in that, I also incorporate anti-Blackness. I think it's a distinct kind of form of discrimination. And you see that in a lot of different cultures. There's this kind of particular discrimination against Black people, or some kind of racial hierarchy where Black people are placed at the bottom of that hierarchy. That exists in science too. And I think that was a very deliberate invention, you know, in this era of European colonization and slavery, where there was very much an incentive to justify the oppression of largely Black and brown people. For example, in the United States, you know, you're enslaving people, doing horrific, horrific things. And there was an effort within science and in medicine to justify that. So maybe to give an example, and this is something that's still relevant today, but in the US, there was a slaveholder and physician called Samuel Cartwright, who some people might have heard of him. He had some very interesting ideas, but one of them was that Black people's lungs are weaker than white people's, and therefore Black people actually benefit from being enslaved, that by doing hard labor, that helps boost their lung function. So that idea, I mean, it sounds very clearly racist. It's not founded in science at all, but that's persisted into medical practice. And, you know, until very recently, there were widespread guidelines to adjust lung function tests based on race, you know, for Black people. And actually, it was only last year that the American Thoracic Society and here in Europe, the European Respiratory Society, they published joint recommendations for doctors and healthcare workers. And they last year changed their recommendations to remove the use of race in lung function testing. And they pointed out that race is a social construct. It doesn't have a biological basis. And of course, there's evidence behind that. But it's surprising in a way that took so long, that in 2023, we're seeing these guidelines change. And I absolutely welcome these changes. I think it's great. I would like to see more of that in medicine.
Yes.
But it's clear that we have this history of racism that is still affecting medical practices and guidelines until today.
Okay, let's talk about racism in medicine. It's relatively recently that the American Medical Association and other medical societies have acknowledged that there is systemic racism in healthcare. But I think it's the rare doctor that would say, I think I'm racist, or I have racist tendencies. How do you reconcile that?
Yeah, and that's actually something I experienced too. I interviewed a lot of people working in medicine, for the book. So I talked to medical students and doctors. And I think actually the impression I have is that, first of all, medicine is a caring profession. And most people I've met are not trying, they're not actively trying to cause harm. It's the exact opposite. People want to help people, they want to care for people. But that doesn't mean that in medicine, you're not then perpetuating a legacy of harm. And I think the example I just mentioned is a good example of this, because if you're following guidelines that are telling you to adjust someone's lung function test result, or also there were kidney function tests that had these race adjustments, then you're kind of following guidelines, you're doing, what you should be doing. And doctors want to follow guidelines because I think that's part of their job. They want to make sure they're doing the right thing. So I think there's that aspect where it's actually embedded into practice. Then there are also, I think, assumptions which are racist, or stereotypes that, for example, Black people feel pain differently. That, again, people might not consciously think, oh, I'm being racist, but they might just think, oh, maybe Black people's skin is thicker. Oh, that sounds reasonable. And of course, when you interrogate that scientifically, it doesn't stand up. But I think that sometimes these things just sound surface level reasonable and people aren't maybe questioning them enough. And then I think on top of that, of course, there are also going to be instances of interpersonal racism. People talk about unconscious bias. Sure, there are prejudices and we might not realize what we're doing, but also there might be even overt discrimination, and people have experienced that as well. So I think it's a combination of those different things. But of course, medicine exists within society. So if we have systemic racism in society, medicine is part of that. Doctors are watching the same TV shows that we're all watching, and they're influenced by the stereotypes there. So although I have enormous respect for the medical profession, I also see that these are human beings, just like all of us. And I think that we should do more to support people in healthcare to tackle these issues, because I think from my experience, most of the people I've talked to do care about racism and want to address it in healthcare.
That's very interesting, because there have been studies that shown that in the NICU, neonatal intensive care unit, that Black babies do better when they're cared for by Black providers.
Yes.
There have been studies that Black men are more compliant with doctor recommendations when they encounter a Black physician.
Mm-hmm.
And so in those scenarios, how would you explain it? Or would you say it's just systemic?
Yeah, so I think that I'm glad you highlighted that, and I cite some of those studies also in the book, because I
Yeah.
think they're telling us quite a lot. And I think they're definitely highlighting something about trust for me, which I also relate to. I've experienced in Germany, maybe it's rare, but in the UK, like when I've had a Black physician, that has actually influenced me, and I have had good experiences where I felt like, wow, this is kind of a rare thing, or at least in my experience. Black people are underrepresented in the medical profession, and I think that should change. I actually think this is one of the issues where I'd like to see more positive change, or increasing diversity in the workforce. I think that's beneficial for all sorts of reasons, but it's also beneficial for patients. I think doctors should reflect the population that they're serving. So I definitely think that plays a role in trust, and as in any field. But I think that's not the whole story. So I think on top of that, we want to also see systemic changes in guidelines. We want to see improvements in medical education and training, because I mentioned that study about users of the medical teaching platform. So around the world, only 5% saying that they're confident in diagnosing across diverse skin tones. So
Yeah.
in Africa, where obviously there's a lot of diversity in skin tones, that figure was higher, but it was still just 29%. So
Mhm.
that tells you a lot that, of course, I think diversity is so important in the workforce, but I don't want that to be kind of an excuse. I think all doctors should be trained to diagnose all patients. And so that is also important. And I think if we're seeing better outcomes, for example, where there's physician-patient race concordance, I think we should also be thinking about what's happening in the case where the race isn't matched, or what's happening. For example, I've had experience with white doctors where I felt discriminated against. What's going on in that interaction? And those doctors also, should be trained and should be able to care for people like myself, or people with diverse skin tones. So I think this is important in both of those cases. But I agree with you that there is definitely an aspect about increasing diversity in the workforce. I think it will be beneficial.
That's very interesting. If I can get a little personal with you, when you've encountered racism with a healthcare professional, how have you responded?
To be honest, not as I would like. I mean, now having written the book and looked at all of this evidence, you know, when you experience something and then you think, oh, I wish I said this, or
I
I should
want to
have
go
made
back.
that argument, or yeah, exactly. So I really appreciate that. Sometimes I talk to people and they say, oh, I want to advocate for myself, but I couldn't. And I have to admit that during pregnancy, that was a very humbling experience for me because, you know, you're very vulnerable when you're pregnant. I had a bit of a difficult pregnancy and birth, and it's like, I just experiencing that vulnerability where you're really relying on people to take care of you, and you feel that I was fortunate that my husband was present. He could advocate for me, but not everyone has that. Sometimes you might be on your own, or you just might not be able to advocate for yourself. So I really think that the onus should be on people, you know, in healthcare to care for everyone, to be trained. But at the same time, I completely understand that people do want to be able to advocate for themselves. Having said that, I have observed in my mother. So my mother trained as a pharmacist.
Okay.
She now actually changed careers. She works in counseling. But when we were young, she used to, whenever we were at the doctor, she used to kind of assert that, oh, I'm a pharmacist. I know about these things. And we used to always laugh at her, my sister and I, like, why is she saying I'm a pharmacist? But now I really understand that I think what she was doing is trying to assert that, hey, I
Yeah.
have some knowledge.
Yeah.
Yeah. And I think in a way that's kind of sad that I've been talking to a lot of black women especially, but black people in general, who say that they feel that they need to kind of qualify themselves, and this is crazy because you should not need to have medical knowledge, expert medical knowledge,
Exactly.
have a degree, you know, to receive
You
care.
gave a good example in your book about yourself,
Mhm.
when the doctor was having you go for, I think, STD testing.
Oh yeah, I can share that
Please,
story if you
please
want, just
do.
for the benefit of listeners.
That's
So
very
this
telling.
was Yeah, I think this is, yeah, it's telling also about stereotypes and prejudice. But during my PhD, I was living in England in Oxford, and I went to the doctor for, I think it was about contraception, so something routine. And the doctor was just asking me general questions about sexual history and things like that. And then at some point, she said, "Oh, okay, I think." She seemed, I would say, a little suspicious sometimes of my answers, but maybe, you know, I'm like, okay, maybe I'm being sensitive. But at some point, she said, "Okay, I recommend that you should get tested for HIV." So I thought, okay, I mean, I'm a virologist, so I'm all for like testing and positivity.
So at this
Um,
point, you're not feeling as though this is negative or that she,
I was a little surprised because my assessment as a virologist, I didn't expect that that seemed like a risk, but I thought, you know, she's a doctor and she's recommending this. And, you know, so I was kind of like, okay. And she said I need to go somewhere else to a different clinic to get the test. So I thought, okay, great. And then, you know, I was getting up to leave. We were having like small talk. And I was wearing like a badge because I worked in the lab. So you needed like a badge to access the lab. And this badge says on it like University of Oxford, and also the kind of, it's like shows that you can access the hospital basically. So she kind of saw my badge as I stood up. It kind of swung down and she said, oh, do you work at the university? Like she seemed really surprised. So I said, oh yeah, I'm actually doing my PhD. And then, what field of virology? You know, we started talking and oh, do you know this professor so and so? They're doing great research. Oh, Oxford University. So she was quite like positively surprised and interested in my research and things. And then as I'm kind of like literally walking out the door, she said very casually, like, oh, don't worry about getting that HIV test. You know, it's very unlikely that you'll have HIV.
mm.
And then I kind of, this is again one of those moments that I think, oh, I wish I reacted differently because it seemed like, so I thought, oh, okay, like, and then as I'm leaving, I was thinking, but what changed? What happened with this, you know, differential diagnosis that all of a sudden my risk changed? Is it that being a PhD student makes my risk different? Which I
Yeah.
think it's also a kind of socioeconomic indicator. So I think what happened is that, you know, she saw a black woman, she had stereotypes about what that means, and she probably also had stereotypes about what it means to be living with HIV. Like for the book, I took to an HIV activist, and you know, so many people are living positively with HIV. I really think we should be removing the stigma from that condition. And something about this experience, it felt like there was stigma about HIV, there was racial stereotyping, and the fact that that diagnosis then changed, or her advice changed, it felt wrong to me. But I think I didn't think about it as deeply until I was actually writing the book. I was interviewing doctors, I was interviewing patients, and then this story came to my mind. And my editor said, I think you should include that in the book as well. And I decided to share because, you know, so many people were brave enough to share their experiences with me for the book that I thought, okay, let me also be brave and share things that have happened, because it might seem like a small thing, you know,
Right.
my life was not in danger, nothing, but I think it's part of a pattern, and it's a dangerous and worrying pattern of racism in healthcare and, you know, prejudice.
Yeah. It's like the little tiny cuts that you get along the way. Um,
Yeah,
and I think we all experience that. And like you, in the moment, we're stuck. Like, what do we do? Do we blow this out of proportion? Are you making a big
right.
deal out of nothing? I mean, it sounds as though when she saw the badges, so you were an exception, or you were like me,
Exactly.
before.
Yeah, and that worries me
Yeah,
a lot because yeah, again, I do not think you should need to be doing a PhD, have a medical degree to deserve good healthcare. We all deserve good healthcare, and we all have the right to ask questions about our treatment. But I really sympathize because there I was, you know, PhD student and everything, and I didn't feel able to really question. It took me a while to kind of process what had happened. And as you said, as a Black woman especially, there are these perceptions that when you question things or just raise any issue, it's like you're aggressive, you're angry, I don't know what. I think there are these stereotypes when it comes to healthcare as well. And so I really appreciate that people are navigating all of that. Of
yeah.
course, I try to advocate for myself, for my loved ones. I encourage people to do the same. And I realize we're not going to just, you know, make racism disappear in a day. But I really, really would love to see more coming from, you know, within the medical profession, because that's where it's actually the job of, you know, healthcare workers to make people feel safe in that therapeutic space.
But I think she thought there was anything wrong about the encounter. Just like you had a
Mm,
moment after you left, I don't think that happened to her.
yeah,
I don't know, but and the problem with
no,
that
that's a good
is
point.
I agree with you that the re, the work needs to be done on the side of the healthcare professionals, but they're not aware, or they don't see
Yeah,
in that.
yeah,
I don't think she would have thought of herself as being racist.
exactly. And that kind of comes back to your earlier question about, you know, yeah, people working within medicine and whether they recognize that, you know, we're all kind of involved in this. Like, this is, that's why I call the book systemic. This is a system of oppression that we're all kind of complicit in. And so I really hope that this will help raise awareness for, because I think there are a lot of people who are very aware of these issues. I mean, for anyone who's just experienced, like what I've experienced, I've shared this with so many, you know, of my friends who've experienced similar things.
Yeah,
But there might be some people who aren't aware of that. And so I hope that by seeing those stories, and also stories where, you know, people, I've shared stories in the book, people experience much more horrific things, you know, almost died in some cases because of the way that they were treated.
yeah.
So I really hope that this will help that people to recognize that, hey, we can all perpetuate racism. We're
Ab-
not, no one is immune to this. This is a system. It's a very human thing. You asked me to define racism. We see this kind of discrimination around the world. Maybe it's manifest in different ways, obviously in different countries. But, you know, in India, for example, there's caste discrimination, which in many ways you see similar, that when people are discriminated against, they have worse health outcomes. And
yeah,
that pattern is clear.
yeah. Yeah, it's almost as though it's a mentality, a way of thinking, because I think even we as Black persons can be affected when you see things like skin lightening or
Mm-hmm.
the need to, I mean, everyone has a right to adorn themselves in any way they choose, but if you only
Yeah.
want to straighten your hair and that's the only acceptable way to look, then you know that we too have been affected by racism. We are affected by it and we carry it within us also. Yeah.
Yeah, I think you're right. There's that internalized racism, which I also think is harmful to mental health,
Abs-
but also to physical health. And as you say, people in the book, I highlight some of the ways that people are taking drastic measures sometimes to achieve kind of Eurocentric beauty standards, or with, for example, hair straightening, but also with skin lightening, sometimes in really dangerous ways that are shown to be harmful to health. I was really happy that the WHO did a report looking at how mercury and skin lightening products, there are these illegal products, how that's affecting people's health, and highlighted that as a public health issue. And I really think colorism is a public health issue. I kind of consider it as part of racism, but it's kind of distinct. And I wanted to also look at it kind of on its own in the book, because I think it's something that operates, within racial groups as well as between groups. There's so many ways in which discrimination touches our lives. And being more aware of it, I hope that even just in our day-to-day interactions with like our families or with friends, colleagues, thinking about, are we perpetuating this? Can we make a change? Because I think that's so empowering. Recognizing that racism is behind so much unfairness in health, it means that we can say, okay, we've named it. Now we can begin to tackle that problem.
Absolutely. Absolutely. Before we run out of time, I want to hear what you have to say about medical research and racism. I know that's a broad topic. So
Yeah.
not sure as little as you like. And the use of artificial intelligence and how that might impact racism.
Yeah, sure. So, I mean, medical research in general, we see a lack of diversity in medical studies. So, in genetic studies, for example, almost 80% of participants are of European descent, just 2% are of recent African descent. So that's a huge inequality. We also see in clinical trials that white people are overrepresented, people from other racial groups are underrepresented. And so that means people are missing out on the opportunity to access medical research, which I think is really important because it's a justice issue. I think that imagine you're terminally ill and you want to be able to access some new treatment that's being developed. That means that, people belonging to marginalized groups are traditionally underrepresented in studies and might be missing out on those opportunities. And there is a whole history, of course, of racism in medicine, right? Where Black bodies have been used as experimental subjects. This is really, really terrifying when you look into the history. And so I think there's an understandable lack of trust sometimes in that medical research. But again, I think that medical researchers, we need to really think about how we can increase participation in studies in an ethical and equitable way. Because that will also benefit the science. There's evidence that genetic studies benefit from increased diversity. And so this is something that in recent years, medical researchers, geneticists have been looking into more. But also we see, for example, medical devices, things are just not being tested on diverse enough populations. Just to give an example, pulse oximeters. So these are devices that are used to measure oxygen levels in the blood. They can be put on the finger and they use kind of light to detect levels of oxygen. And, for years, it's been known that these devices work less well on darker skinned people. There are studies as far back as the 90s showing that there are inequalities and that, pulse oximeters don't work as well. They overestimate oxygen levels in Black people, which can have profound implications. This is something that came up actually during COVID. Because oxygen was important. Obviously, it's a respiratory disease. And so, again, we saw inequalities, racial inequalities there, and I'm sure these things also played a role. So there are a lot of ways that we see inequalities that are being perpetuated by research and medical devices. And then, yeah, you mentioned artificial intelligence. This is obviously being very widely discussed now in general, but in healthcare, there's huge investment. Companies are really interested in looking at the use of AI in healthcare, and it's already being used. There was actually a study in 2019 which showed that millions of Black people in the US were missing out on healthcare because of a widely used algorithm. So this was an algorithm that was helping to prioritize patients in hospitals, so deciding basically who should receive care. And the algorithm was using prior healthcare costs as a kind of predictor for future healthcare needs in populations. And for many of the reasons we've already talked about today, systemic racism, we see that Black patients generate lower healthcare costs than white patients. That's not because Black patients have less need or are less sick, but because of all of those inequalities and racism that we've discussed. But unfortunately, because of the way the algorithm was designed, it was prioritizing less sick white patients ahead of sicker Black patients. And then so perpetuating those inequalities we already see. So I think my concern with AI is that we don't want to embed racism further in using technology. We don't want to automate discrimination. So I think we need to be really careful. There needs to be regulation of these technologies. And I should say that the researcher who did the study revealing this bias in that AI, he actually worked with the developer of that algorithm. to help them to remove the racial bias, so to change the way the algorithm worked. And I think that's great that that company kind of took the initiative to tackle the problem. But I think we need regulation to make sure that companies have to do this, not once the algorithm is already out there and is already being used and tested basically on us, but actually before that stage, we need to be making sure that when we develop a device, we're testing a medicine, we are developing an algorithm, that we are testing that on a diverse population that represents the population who that algorithm or that technology or that medicine is going to be used for. So I think this is a crucial area, and I think biases in medical research are also one way where we see racism can also be harmful to our health.
Yes. I think another point you made in the book is that there is a level of distrust of Blacks with clinical research. I mean, there's just a long history of abuse and not being treated when we needed to be. But I think we need more than just participation in the studies. We need people who are evaluating the study. We need people of color who are designing the study. We need people of
Exactly.
color all throughout the process, from the
Absolutely.
inception to the design, to the monitoring, to the subject matter. And I think we need that in order to have the data that we can then feed into the artificial intelligence, so that they will have something besides what works for a white male, you know?
Yeah, I completely agree with you. I think that's so important. It's, and starting from the very top, when I worked in medical research, it was clear that basically people like me are not well represented at the top of kind of academic medical research. And that has a huge impact, because what kind of questions are you asking? What kind of research questions are you interested to address? Like,
Right.
what communities are you serving with your work? I mean, I completely agree with you. I think at all levels, we need to address this. And similarly in medicine, that's why having more diversity in the medical profession, it means that we're asking these questions, we're considering these problems. And I really hope that's something that inspires me a lot, talking to especially a lot of the medical students that I interview in the book are students of color who are questioning racism in medicine, questioning racist guidelines. And I found that really interesting, that it's people who are quite junior in their career who are actually asking these questions. So I really want to see that also translated,
Any thoughts
across.
about why that might be?
So interesting. It's a good question. I mean, I would say that in general, a lot of people of color at all levels are the ones speaking up. But of course, because of racism, because of biases in hiring and so on, and people training in medicine, you see less diversity, going up. So that might be one thing. But I also think maybe there's something about the younger generation, that perhaps they're more skeptical of race being used in medicine, or of thinking about racism. So I think there are a number of things going on. But I should also point out that there are, senior doctors Black doctors in the US, who have been talking about this for decades. So I definitely don't think, it's not that this is not a new topic. With the book, I wanted to bring together a kind of resource for people who say, oh, I'm interested in this, but I'm overwhelmed. There's too much information. That, okay, here you go. At the back of the book, I have a list of advocacy groups, resources. In the book, I tried to highlight a lot of the people who are already working towards positive change.
That's a Because that was one of the things I was going to ask you. What would you tell that Black woman who's contemplating pregnancy, who's worried that she's not receiving the type of care? Do you have any suggestions or advice to share?
Yeah, so I think what helped me is particularly in pregnancy, because I agree with you. I was also worried. I was actually editing the book in the late stages of my pregnancy, and it was difficult, because coming face to face with some of the statistics and stereotypes in medicine, that particularly around Black women and birthing people. So I think something that helped me was thinking about how to advocate for myself in the healthcare setting, being more confident to ask questions, or also to bring an advocate with you if you're able to. Obviously, I appreciate that this is a privilege in some way, having someone who can come and speak on your behalf, but I think it can be helpful to just have someone echoing what you're saying, because
And also,
unfortunately there are stereotypes.
someone that's
Yes,
being said that can advocate.
absolutely.
Yeah, yeah.
Yeah, and then but yeah, I also think there are recommendations to, for example, seek a second opinion. There's just knowing that you do have rights, and that this is what's happening in your body. You are the best, the expert on what's happening in your body. And I think for a long time, Black women are made to kind of almost doubt or they're not being believed as kind of reliable narrators about their own body, the pain they're feeling, and so on. So I think it's definitely recognizing and being in tune with your body and being confident to speak up. But as I said before, this problem is not going to be solved only, I think people are doing the best that they can do. As I mentioned, you asked me, how have I been advocating for myself? I find it difficult. And it's like I have a PhD in a kind of medical research field. So I really think that this is a difficult thing. And I think we need at all levels, like also grassroots organizations who are campaigning for Black women's health. There's a great organization in the UK that I took a lot of inspiration from, but also in the US, there's the Black Mamas Matter Alliance. So lots of organizations who are advocating for Black women and birthing people. I think they also have great resources that I think are really helpful. But yeah, short of just eradicating racism in a minute, obviously, we want to do our best for ourselves, for our family members, and also for if you know someone who's going through pregnancy or you have a family member who's experiencing ill health, we can all advocate for each other. We can share knowledge and try to just strengthen ourselves like as a community. But no, I think this is a bigger problem than just individuals, and there will also have to be really systemic changes. So I am hopeful. I still feel reasons for hope. I think there are people get overwhelmed by this, but I think there are just simple things we can already start doing to tackle the problem. And people have shown us we can teach doctors how to recognize health conditions on diverse skin tones. We can remove racial bias from clinical algorithms. We can increase diversity in medical research, and just all of us, we can feel empowered by this knowledge about the health harms of racism. We can take control of our health journeys, whatever our background. I really think if we can tackle racism in society, but also especially in medicine and science, it's going to make us healthier, but also happier. I really think that this is something beneficial for all of us, and we should all be advocating for this.
Yeah. And I just would echo what you said, that as a doctor, I agree that it's the rare doctor that goes to work trying to figure out how to harm someone.
Exactly.
If for no other reason, at least in the United States, there's malpractice. You
right.
practice to go up. But I do have to acknowledge that there is a power imbalance when you're in the doctor's office. You're talking to someone who you might be willing to let operate on you.
Yeah, absolutely.
Have someone that may have to prescribe a medication that you need. And so you don't necessarily want to piss them off, right?
Yeah, I felt that too. Yeah.
But I think that there is a way to ask a question, because if the doctor's just going through the routine and no one ever asks the question, then they never think they're doing anything wrong. I think back to the doctor with the STD testing for you. If she questioned on that, not in an accusatory way, but what changed here?
Yeah. Yeah. Why did your recommendation change?
I mean, and so I think if we can ever, and it's hard to do. I'm not trying to say that in the moment you can do that, but if you just pose the question, that gives them or gives us a moment to stop and pause. And then the other thing is numbers matter. When a doctor sees that you're accompanied by someone else or other people, your significance rises. And so if nothing else, bring someone with you, even if they don't say anything. They don't have to say.
It's also a kind of a witness, essentially, right? Who's there, who can listen, because sometimes also I think people feel a bit gaslit almost in their experiences. Whereas when you have someone else there who could say, oh, wow, that didn't seem right, or it can really help. So I appreciate that not everyone's able to do this all the time. It can be really difficult. But yeah, if we can advocate for ourselves, and to healthcare workers, I agree with you. I really think it's a caring professional. I'm really grateful for the work people do. It's worth saying how challenging that job is, right? You're caring for people, people in who are really ill. Yeah. So I hope that my book can also help help people to just that pause and to reconsider, even if it's just taking like a second more to think, and even just challenging ideas that have become kind of routine.
Yes.
I think that will be really powerful.
Yeah. I see your book in the corner, so why don't you bring it to.
Oh yeah.
Yes.
Yeah, this is the US one. So it's Systemic: How Racism is Making Us Sick. In the UK, it's how racism is making us ill. I think it's some UK US, spelling or English, but yeah. So it's available now. It came out last month, but it's available, anywhere that you buy books. And yeah, I'm really grateful for your interest and for caring about this topic. I think what that inspires me the most is people working in healthcare and medicine who care about this. Because of course, although racism affects us outside of healthcare and in society, we come to see our doctor when we are in that vulnerable place, when we need help with our health. So I
Yes.
think it's such an important starting point to tackle these problems.
Well, thank you. Thank you for the work you've done.
No, thank you so much for highlighting it and also for your important work.
Yeah. All right. It was a pleasure. It was a pleasure speaking with you today.
Likewise.
Do you have a website? Is there any way people can get in contact with you? Please share.
Oh yeah, absolutely. So my website is layalliverpool.com. So my first name, my last name.com. And I'm on social media as well, like Instagram, Twitter, TikTok, at Layal Lives. So it's LAYALLIVS. Yeah, and so I've been really appreciating people also reaching out, and some people have been sharing their experiences of racism in healthcare. So that's also quite validating, just hearing each other's stories,
Absolutely.
realizing that this is, it's not just me. This
Not
is
just-
happening out there.
Yes. And you're speaking to us from Berlin today, correct?
That's right. Yeah, I'm confused. I've lived in too many places, but yeah, I spent a lot of time in the UK. I'm British, but I currently live in Germany. So since 2020, I've been living in Germany. Yeah. So I'm working as a science journalist. So since 2019, I moved into journalism right after I defended my PhD. And yeah, I focus on reporting on inequalities in science, health, and medicine, but also in general, I've covered technology, space, the environment, different topics. Most recently, I was working for Nature, which is a science journal. So it's mainly read by academic scientific researchers, but I've also written for The Guardian, other outlets, like you mentioned in my introduction at the beginning. So currently I'm actually on parental leave. That's a good thing about Germany. They have parental leave. I think everywhere should have this.
Can I ask
Another topic.
how much parental leave do you get in Germany?
So 14 months of paid leave that can be shared between the parents, but actually up to 3 years of leave unpaid. So yeah, there's a lot of, which means your employer, cannot fire you for those 3 years if you choose to take time. I'm personally taking a bit less than that. I'm also taking breaks to do, conversations like this and things to do with the book because I'm really passionate about it. But I think it's really great that Germany has that lever, and it's actually one of, I think, many things that I think could help with some of the problems I'm talking about. Without getting too political in the US, but I think there could be much more support for women and people giving birth. It's not enough, in my opinion, and I think this is a health issue too. So
Issue.
perhaps my next book.
Your next book, that's right. It was a pleasure. Take care and best wishes to you and your family.
Oh, thank you so much, and same to you.